So it's a pleasure for me and a great honour to be talking at the Royal Society. So thank you for this opportunity to present to you some of the research that we've been doing at RMIT University and over my 20 years of my career, asking the question, livable cities for all, are we there yet? There's been this growing concern about this rapid urbanisation that we're experiencing across the globe, but also population growth. By 2050, our population will be expanding, but 68% of our population is going to be living in cities, which makes cities a very important place for us to think carefully about that. Our population is growing, even in highly urbanised countries like Australia, and this calls to us that we need to really think carefully about the way we're planning our cities. Now that's important because by 2050 we're going to need to build an extra 1.6 million new residences. It's putting pressure on our resources and our infrastructure. We cannot continue to grow our cities even if they are electric cars because traffic congestion is very expensive. The reason why I got involved in the concept of livability is because of this man, Dr. Ian Butterworth, and he was very concerned about what was going on, and he asked me whether I would get involved in his area and this topic of place and health. These are the social determinants of health, the conditions in which people are born, grow, work, live and age, and the wider forces and systems that shape daily living. But the question for me, could we reframe the social determinants of health through the lens of livability? When I think of really livable cities, I think of places that are a little bit smaller, I suppose, but, things like Copenhagen. One could think of Barcelona and think, well, that's a terrific city. Now, the problem with Barcelona, of course, is they've got air quality and noise problems because they haven't managed the traffic. So one has to really, if you want to have a compact city, which I think we need from a global perspective, one also has to manage traffic. Can't just have compact, otherwise it's high-rise sprawl. So it's really important that we're thinking about combining land use with transport, and that's why we call for this idea of integrated planning, because unless you've got land and transport being done together, you end up with perverse outcomes. And it's really, really important. What is livability? A livable community is one that is safe and socially cohesive and inclusive. It has to be environmentally sustainable. It has affordable housing and diverse housing, but it's no point providing affordable housing on the fringe of cities if it's not linked by public transport, walking and cycling infrastructure to employment, to all the services that you need for daily living. We took the view that what will get measured will get done. And we started to ask the question, are we creating a livable city for all? We thought, well, what are the sort of domains of livability? We said it was access to public open space, access to public transport, how walkable a neighbourhood is, how affordable the housing is, whether people have access to employment, whether they have a supportive food environment. And we also put in alcohol environment. This was something that one of our industry partners, our funders, wanted us to measure, so we measured that as well. So here we were, our primary question, are the underlying domains of livability associated with health and wellbeing? There are associations. The measures of the built environment we created were all policy relevant, so it spoke to policy, but we also wanted to identify which of these were most associated with health. I think people are very different throughout the world, and that's a challenge in terms of how things are implemented on the ground in different cities. Most people need to have access to a school. Most people need access to doctors, however it's described in a different country. Most people need access, if we want people to walk, they need a walkable community with somewhere to walk to. But how it looks in a place may differ, but in some ways the metrics are somewhat similar because people everywhere will need those things. The second question that we wanted to ask is, are there spatial variations in access to health-promoting amenities in Melbourne? So the first thing we did was looked at Melbourne's, this is just the Melbourne's, we've got data for this nationally, Melbourne's walkability. And you see a very clear pattern here. You can see that we've got a nice walkable grid, but once you start to get out to the outer suburban areas, lots of pink, very low walkable areas where you expect that everyone's driving. We also had measures of social infrastructure. We looked at about 16 different types of social infrastructure, whether people have access to a school, whether they've got GP surgeries nearby, whether they've got supermarket. And we looked at, again, what's the pattern across the city? And we find a similar pattern, that in the inner city, where it's nice and green, we see that it's really terrific, lots of access to social infrastructure. But if you're living out in the fringe, the pink areas, some of those people are living out in the fringe with 0 to 1.4 different types of social infrastructure, not much access at all. So the third question that we wanted to address in our research was, does the concept of urban livability affect health and well-being? And to do that, we wanted to provide an alternative way of looking at the Livability Index. The index that was developed by the Economist Intelligence Unit is to actually decide what the loading should be for executives who are moving to Melbourne. So we wanted to create a livability index which was about the lived experience of people living in Melbourne. So what we did to do this was work that was done by Carl Higgs. It was a beautiful piece of work. He pulled together all these different types of measures of livability and put it into an index. And lo and behold, you see a similar pattern as you might expect. People in the inner city live in a very livable area. People on the fringe have a much less livable area to live in. For every unit increase in urban livability, the likelihood of people walking, cycling, using public transport increased by about 10 to 15%, and the likelihood of people driving decreased by about 12%. We wanted to take this work nationally. One of the key questions we wanted to ask in this was, do we have the policy environment or frameworks in place in Australia to deliver healthy, livable cities or not? And when we look across the policies generally, we don't have the policy frameworks in place in Australia to achieve the cities that we say we want and need. We looked at Melbourne, Sydney, Perth and Brisbane, and you see a similar pattern to what we saw with walkability, not surprisingly. Again, in the inner city, you're starting to get up to the higher levels of density. Out in the fringe, really low density. Sydney has more density, but again, you can see a lot of areas where the densities are too low. Now, when we look at where in these cities are these policies being delivered, so these are the only suburbs where there was a significant number of people with this sort of levels of an average density of 15 dwellings per hectare. Most of the rest of the city is not going to ever be walkable because it's very hard to achieve a walkable environment if you don't have access. The densities aren't higher. For Melbourne, for example, 27% of people live and work in the same area. Okay, not everyone but even in the outer suburban areas. And quite a lot of people live and work in the area in the outer suburban areas. But very few of them walk or cycle to get there. They all drive. That's a lot of people who could potentially use an alternative. Particularly, we did a report a few years ago for Australian Council of Learned Academies, and we had it in there, included some maps which showed what it would look like in Melbourne and Sydney if we put cycle paths within 5 kilometres of all the train stations. Now, if you also did that for all the activity centres across cities, you'd be amazed how much of the city is connected by doing that. We made a number of recommendations out of this report. First of all, we argued that there needed to be evidence-informed policies. We suggested that there needed to be short, medium and long-term targets. It's very hard to turn the ship around when we've got the challenges that we have in our cities. We suggested that the spatial indicators are very useful and actually seeing benchmarking and monitoring cities so we can actually see what we're delivering on the ground for the people who we're trying to serve with our policies. And we suggested that if we really want to change our cities, we need metropolitan governance, because one of the challenges in terms of delivering these sorts of cities is that we need integration across all the different sectors, both vertically, federal government, state government and local government, but importantly also horizontally across all the different government departments. So is any of this important? From a health point of view, the sorts of risk factors I'm talking about, walking, cycling, using public transport and having more physical activity, is clearly really important for cardiovascular disease, stroke, diabetes. So we see these patterns. So there are incredible gradients in people's health, and we would argue that the environment in which people live contribute to that. But of course, the biggest threat to human health, we now recognise, is climate change. And the solutions require a shift in the way we're building our cities as the contributor to reducing emissions. So, livable cities for all, are we there yet? I think we can firmly say that we have a way to go. And this is important because not only is it affecting chronic disease, but also with climate change, it will affect our health, all of our health, the ecosystem health into the future. This isn't a dress rehearsal. Cities are a major emitter of emissions, and transport is a huge contributor to that. We really need to do things differently. We cannot continue to put our hands over our eyes and say, well, we can continue to live just as we always have. The work I've been doing is focused on chronic disease, but it ties really beautifully to an agenda around mitigating and adapting to climate change. We all need to change, and that's not easy, but it's something that we all need to do. And I think what we've tried to do is to provide the metrics to help what we need to do in our cities. And I think it'd be great if we could, policymakers picked up and were able to contribute, but they'll only do what the public want. So I think go and speak to your politician. This is important stuff.